Chapter 5, Sexual Orientation. Sexual orientation concerns the direction of one's romantic interests and erotic attractions, either towards members of the same gender, members of the other gender, or even both. So a heterosexual orientation is an erotic attraction to and preference for developing romantic relationships with members of the other gender. Many homosexual people refer to heterosexual people as straight. Now, a homosexual orientation is an erotic attraction to and preference for developing romantic relationships with members of one's own gender. Homosexual men are often referred to as gay males. Homosexual women are often called lesbians. The term bisexuality describes an orientation in which one is sexually attracted to and interested in forming relationships with both males and females. Now, the term homosexuality can be somewhat controversial. Many people would prefer terms such as gay male or lesbian sexual orientation. Your textbook refers to male-female sexual behavior, not heterosexual behavior, male-male sexual behavior, and female-female sexual behavior to help distinguish sexual behavior from sexual orientation. Gay people have a gender identity that is consistent with their anatomical gender. So they have anatomically, they are male, and they identify their gender as being male. They don't want to be the other gender. Instead, their romantic attachments are directed towards their own gender. So sexual orientation is not defined by sexual activity per se. It is the direction of your romantic interests and erotic attractions. Alfred Kinsey believed in what is called the Kinsey continuum, which states that exclusive heterosexual and gay sexual orientations lay at opposite poles of one continuum. So the more heterosexual a person is, the less gay that person is, and vice versa. There are a number of reasons why it's difficult to determine the incidence of gay men and lesbians in the population. The exact definition of homosexuality is a little unclear. Sexual behavior does not exist in two opposite poles, and there's no well-defined delineation between what makes a person a homosexual versus a heterosexual versus a bisexual. Sexual orientation is not strictly defined by your sexual behavior. So engaging in sexual activity with a member of one's own gender does not necessarily mean that that person is gay or lesbian. It is not unusual for an individual who self-identifies as heterosexual to have had some sexual experience with people of their own gender. Similarly, individuals who self-identify as gay may still engage in pleasurable male-female sexual activity. So a person may self-identify as gay or lesbian without ever having engaged in sex with members of their own gender. And then finally, the classification of homosexuality is difficult as erotic interests may shift over time. Women's sexual orientations appear to be more flexible than men's. So on a previous slide, we discussed Alfred Kinsey's view of the Kinsey continuum, that heterosexual and gay sexual orientation lay at opposite poles of one continuum. Now, researchers have found that the two-dimensional model may hold only for women, if it's even valid at all. Research also suggests that women's sexual orientation is more flexible than men's, and those men tend to be more homophobic. An alternative model measures homoeroticism and heteroeroticism as separate dimensions and suggests that a person can be high or low on both dimensions simultaneously. So, bisexuals may be high in both homoeroticism and heteroeroticism, while an asexual individual might score low on both scales. So according to this model, a bisexual individual may be as responsive to stimulation by people of the other gender as heterosexual people are, and just as responsive to stimulation by people of their own gender as gay people are. So it's not a clear-cut thing, which is why it can be very hard to measure. So Alfred Kinsey considered sexual orientation as a continuum from heterosexual to homosexual, suggesting that the more heterosexual a person is, the less gay that person is. So the Kinsey scale shows a bipolar distribution. A bisexual individual would be less responsive to stimulation by people of the other gender than heterosexual people are, but more responsive to stimulation by people of their own gender than heterosexuals. Now, as if this wasn't confusing enough, some actually classify bisexuality as a separate orientation in itself. Bisexual people are sexually attracted to both men and women, and many have a somewhat stronger attraction to people of one sex than the other. In ancient Greece, men frequently formed sexual relationships with adolescent males. Now, Jews and Christians have traditionally regarded male-male sexual activity, which is known as sodomy, as a sin. Early Christians considered any non-procreative sexual acts to be sinful, so that included oral sex, anal sex, as well as masturbation. And by the late Middle Ages, this also included non-procreative sexual acts, even within marriage. Male-male sexual interactions exist in most cultures. While in a majority of pre-literate societies, these interactions were considered normal for some members of the group, in other societies there is societal disapproval or punishment for male-male sexual activities. Male-male sexual behavior is more common in societies that highly value female virginity before marriage and in which young men and young women are segregated. Now, some societies permit or even require male-male sexual activity. This activity may be limited to rites that mark initiation into manhood. These activities involve homosexual behaviors, not necessarily homosexual orientations. Animals engage in sexual behaviors that resemble same-sex contacts among humans, although the behaviors may represent more a dominance ritual or even a form of play. There are some species, such as rams, that show long-term same-sex relationships. So we're going to look at the biological perspective of sexual orientation, genetics, the brain, and sexual orientation. Considerable evidence exists that there is a genetic influence on gay and lesbian orientation. The concordance of homosexuality among monozygotic twins or identical twins is higher than it is among dizygotic or fraternal twins. Gay males are more likely to have gay male relatives on their mother's side of the family. The pattern of inheritance is consistent with X chromosome-linked genetic traits. Now, as far as the structure of the brain, evidence suggests that there may be more structural differences between the brains of heterosexual and gay men. In the study by LeVay, part of the anterior hypothalamus was found to be smaller in gay men than in heterosexual men. These findings are intriguing, but they are still preliminary. In non-human species, sex hormones strongly influence mating behavior, but no connection has been shown regarding sexual orientation and levels of sex hormones in human adults. Testosterone does affect the intensity of sexual desire rather than the preference for partners of the same or other gender. Prenatal sex hormones may play a role in determining sexual orientation in people. So we've been taking a look at the biological perspective on gender orientation. So now let's look at the psychological perspective. According to Sigmund Freud, which is the psychoanalytic view, Freud believed that children are naturally open to all forms of sexual stimulation. Now, if you have a gay sexual orientation, Freud's believed that that could develop in a male as a result of an unresolved Oedipus complex, the desire to marry your mother and have your father out of the way. For girls, it is an unresolved Electra complex where little girls want to marry their daddies and they want mom out of the way. Freud also believed that unresolved castration anxiety could play a role in the gay male sexual orientation. So, and this is all in the unconscious, according to Freud, both the Oedipus complex and the Electra complex, as well as the unconscious castration anxiety. It's important to note that there has been no scientific evidence to support Freud's theories. Now, learning theory states that your early experiences play an important role in the development of your sexual orientation. For instance, if sexual encounters with others of your own gender are pleasurable, while experiences with people from the other gender are unpleasant, then a gay orientation may develop. However, most adolescent encounters with people of the same gender do not lead to an adult gay orientation. Also, the majority of gay males and lesbians were aware of their sexual interest in people of their own gender before they even had a sexual encounter. Gender nonconformity means not behaving in a way that is consistent with the gender role stereotype attributed to your anatomical sex for a given culture. So basically, you're not behaving in that kind of typical male or female way that your culture has outlined for you. Gay males and lesbians are more likely than heterosexuals to report childhood behavior that is more stereotypical of the other sex. Gay males are also more likely to recall feeling more sensitive than their peers and to show less interest in typical boys' toys and activities. Gay males are more likely to recall feeling more sensitive than their heterosexual peers during childhood. Lesbians are more likely to perceive themselves as having been tomboys. So in fact, one study, they looked at lesbians who either self-identified as being more butch-like in their behavior or more femme-like in their behavior. The lesbians who identified as being more butch-like were significantly more likely than femme lesbians to recall gender atypical behavior preferences in childhood. In other words, they were much more attracted to doing boy-type activities. Butch lesbians also tended to have higher waist-to-hip ratios and higher testosterone levels in their saliva. So overall, the origins of a gay male or lesbian sexual identity are as complex as the origins of heterosexuality. Sexual orientation probably results from a combination of genetic, biochemical, as well as psychosocial factors. Negative attitude towards gay males and lesbians does still persist, but these attitudes tend to be changing and people are becoming more tolerant of homosexuality, especially in Western cultures. Those who have negative attitudes tend to more identify with a traditional gender role. They tend to be older and have more children. They also tend to be less educated. People who have a negative attitude towards homosexuals also tend to hold a more fundamentalist religious orientation and attend religious services more frequently. They also tend to hold more conservative political beliefs, and they also tend to have less contact with gay men or lesbians. With regard to sexual orientation in the law, gay people have organized political groups to combat discrimination and overturn laws that have targeted them. Over the years, the Constitution's right to privacy has been in conflict with some state laws that are against same-sex sexual behavior. Gay activism is the joining together of gay people to achieve various political ends. For instance, gay rights organizations work to combat the HIV/AIDS epidemic by fighting for increased funding, services, and education. This slide also gives examples of other ways that gay activism has helped to promote the gay rights agenda. Through the media, TV, and movies, we see a lot of stereotypical behavior of homosexuals. Some heterosexual people oftentimes assume, sometimes erroneously, that in a gay male or lesbian relationship, one partner consistently assumes more of a masculine role and the other partner assumes more of a feminine role. At some level, this is kind of an attempt to make a parallel between a homosexual relationship and a heterosexual relationship, but it's not always accurate. So because of the stereotyping and discrimination that can happen towards homosexuals, are homosexuals more likely than heterosexuals to suffer from mental disorders? Until 1973, homosexuality was considered to be a mental illness by the American Psychiatric Association. But in 1973, the diagnostic category was abolished. Studies have shown that gay men and lesbians are more likely than heterosexuals to experience feelings of anxiety and depression and are more prone to suicide. So the psychologist J. Michael Bailey suggests that this may be due to societal oppression, or it could also be related to alterations in prenatal hormonal levels. Overall, differences in adjustment are more likely to reflect the lifestyle of the individual than his or her sexual orientation. In other words, gay men and lesbians who are in stable, intimate relationships are about as well adjusted as married heterosexuals, while older gay people who live alone are more poorly adjusted, as are older heterosexuals who live alone. Homophobia, or fear of homosexuals, tends to be one of the last accepted prejudices in American society. It can take a verbal form, as in the use of derogatory names, or it can involve active discrimination or actual physical abuse against gay people. Gay bashing often involves physical and sometimes even lethal abuse. Homophobia is more common in those who fear a gay sexual orientation within themselves, or in those who have a strong stake in maintaining stereotypical gender roles. Generally, heterosexual males are less tolerant of gay people than are heterosexual women. Homophobic attitudes are more common among males who identify with the traditional gender role, who hold a fundamentalist religious orientation, or who hold conservative political beliefs. There was a study done in 1996 by Adams et al. Who showed that unlike non-homophobic males, males with homophobic attitudes were physically aroused by videos showing male-male sexual activity, although they denied this activity. The advent of AIDS has increased the hatred, discrimination, and violence against gay people. Because when AIDS first appeared, it struck primarily the gay male community. Prior to 1973, it was believed that homosexuality was a mental health disorder. However, in 1973, the American Psychological Association abolished that category. But the belief was that homosexuality was a choice, and so with a certain kind of therapy, that homosexuality could be eliminated and homosexuals could be converted into heterosexuals. Hence the beginning of what is called conversion therapy or reparative therapy. However, these therapies have found to not be effective, and in fact, the American Psychological Association has actually deemed them to potentially be dangerous as well as ineffective. Now, Masters and Johnson believed that they were able to reverse sexual orientation by giving homosexuals a positive sexual experience with a person of the opposite sex. But what was found was that this was really only effective with people who were either already bisexual, who were married, or who were highly motivated to change. Because of the backdrop of social condemnation and discrimination, gay men and lesbians often have to come to terms with their sexual orientation. The process of accepting their sexual orientation is known as coming out. Now, there are 4 steps in the development of a gay sexual identity. So coming out to yourself involves these steps. They include attraction to members of the same sex, labeling yourself as gay or lesbian, sexual contact with members of the same sex, and then disclosure of one's sexual orientation to others. So the last step in the development of a gay sexual identity, as discussed on the previous slide, is the disclosure of one's sexual orientation to others, coming out to other people. Now, there are different patterns of coming out to others. Coming out occasionally means just an open declaration to the world. People sometimes do it on Facebook or on Twitter or other social media. More often, though, a person may inform only one or a few select people that they feel close to and they feel like they can trust. Disclosure can oftentimes be fraught with a lot of risk. You might lose friendships, you might lose family members, you might lose social standing, and potentially even your job. There's a tendency to treat gay people as if they were all the same variation in sexual expression that exists within and across sexual orientation. However, it's important to remember that there's not one gay lifestyle any more than there's a single straight lifestyle. In 2015, the Supreme Court decided to recognize gay marriage, and since that time, we have started seeing a change in our culture and the attitude towards same-sex marriage.